Hello, everyone. Welcome back to another episode of the Dental Hygiene Basics podcast. My name is Dana. I am your host, and I'm here with the amazing Maria Jackson today. We have so much to talk to you about. I'm really excited to dive into AI in the world of dental hygiene. So, with that being said, Maria, just tell us a little bit about you. How did you get on this journey to becoming a dental hygienist?
Hi, nice to meet you and be here. I'm so excited. So I've been a hygienist for 17 years or so. My dad was an oral surgeon and he's retired now, but I've been in dentistry my whole life. And, there was never once a moment that I didn't want to be in dentistry. I sometimes even think, I never even gave myself a chance to venture out to any other. Industry, although I absolutely love it, but yeah, that's how I got into the industry. And yeah, I did hygiene for 17 years and now I have my own business and I work with startup companies.
Amazing. I love it. So, let's go back to that beginning journey. You have this interest in dentistry, your dad's an oral surgeon, and you're applying to dental hygiene schools. What hygiene school did you eventually end up going to?
So I only applied to one and it was the Phone School of Dental Hygiene. I was interested in one of their master's program. I actually had a bachelor's in biology at the time, and I didn't know at the time that you couldn't go from having a bachelor's in biology to jumping straight into like a master's in hygiene without being a hygienist. I called the dean and she was telling me that I had to go through the whole program. So I decided to apply. I got accepted and it was then that I just really wanted to pursue dental hygiene and follow that track instead of going the the general dentistry track. I really wanted to go into the preventative side of dentistry.
That is so interesting to me because I mean that's just such a common experience where we have a plan and then we think, "Oh, this is what I have to do." And then you realize, "Okay, maybe I did that backwards or I should have done this before I did this." But
Yeah.
when you started with your bachelor's degree in biology, were you thinking initially general dentistry or was the plan hygiene all along?
It was always general dentistry, and somewhere along the line, I was I was tutoring a lot and I wanted to teach, but it just made sense once I really looked into dental hygiene that this is what like I really needed because it was very like educational. Not only can I teach other students, but I also do day-to-day teaching to patients. And you have this relationship with patients that doctors don't normally have.
Yes, I love that. And so you went on, got into dental hygiene school. Did you get in on your first try?
I did get in. I don't know. Actually, I think I was even overqualified because they wanted to make sure that I wasn't using that as a stepping stool to get into dental school. So I got a call and they told me, "Is this what you really want to do? Is this like your long-term goal, or is something you're trying to kind of add to your resume to go into dental school?" And I just had to reassure them that, initially I wanted to go into dental school, but I had taken a different path. I wanted to go into education, and then I kind of ventured out into dental hygiene, and I realized this is where I need to be.
Really, I'm so glad that we're having this conversation because I, like you, had started out planning to go to dental school. And when I applied to dental hygiene school again for the second time, long story, I really did think I would end up going to dental school. Once I got into hygiene, I realized, oh my gosh, this is where I was supposed to be the whole time. Like, forget the rest, right? But I
Yeah.
really think it's important to mention to our students that are listening that you have to tread carefully if you think you're going to continue on and maybe go that general dentistry route and go on to dental school to become a dentist, because a lot of hygiene programs, they want to accept people who this is their passion. They want dental hygienists, right? That's what they want to create and that's what they want to put out into the community. With that being said, there are plenty of hygienists that go on to dental school, and I personally think it's a good thing. We need more hygienists to go on to dental school because
Yeah.
then I think we're going to see better integration between dental hygiene and the dental profession. But that could impact your spot if you bring that up, and thankfully you already knew what you wanted to do, but
Absolutely.
that could
Yeah.
be a scary conversation, right?
Right now, it's I don't know. like, I'm in Florida, and we only have, like, 2 dental hygiene schools in the area, and I mean, it is saturated. It's really hard to get in. And I just feel really sad for the dental assistants that are trying to go, and better their education and they want to become dental hygienists because it's really hard for them to get in as well. So I can only imagine, like, you know, all the students that are also trying to apply, plus all the people that are already in the industry. And it's just like, there's just like not enough spots.
Yeah, yeah, which is so interesting because across the nation there's a shortage, I'll say in quotation marks, but there are still these oversaturated areas, and sometimes the oversaturation is just that there's not enough schools to create dental hygienists. So we do have to be a little protective of who comes into the program because we want to make sure whoever gets accepted has the highest chance of becoming a dental hygienist. So
Absolutely.
okay, that's great. So once you're in dental hygiene school, now is the phones dental hygiene school, is that the very first dental hygiene school?
Yeah.
Okay,
Yeah.
that's what I
I'm in
thought.
Connecticut. Yeah, it's actually in the University of Bridgeport in Connecticut. I'm still pretty well affiliated with, like, the school and the teachers. Like, I love the school. The program is amazing. I highly recommend it. I had a really nice scholarship, so I took it.
Yeah, absolutely. Heck yeah, we'll take any scholarships, right? We need that
Yeah.
money to get through it. I love it. So once you were there, what do you feel like was the most difficult aspect for you?
Honestly, for me, was not being with my family because
Mm.
I was from Florida and I had nobody that I went to school with. It was all new friends, and I had no family, no acquaintances. So, like, I guess mentally, and emotionally, I was kind of like a mess because it
Yeah.
was a 2-year, very hectic, very hard program, that took up all of my time. I also worked as a school ambassador, um, and doing open houses, but mainly it was just not being with family, that I had to kind of protect, like, my mental health. I was so many times ready to, like, just be done with it, but I just had to stick through, and I just had to see the whole thing, like, finish. I had to finish through so that I can come back home. But I'm glad I did it. It taught me a lot. I grew up a lot, and it was a great experience for sure.
Yeah. How old were you when you went up there? And I guess my question is, were you living in Florida and you specifically moved for that program? That's what happened. Okay, she's shaking her head. Yes, if you're not
Yeah,
watching the video.
yeah,
Yeah, okay.
absolutely. I moved just for the program, and I was actually not that young. I was not as young as a lot of my classmates were. A lot of them were 18, 19, 20. I was every bit of like 25,
Yeah.
26, when I started the program. Yeah, I and even so, I just, like, I wish I had some family, but I had a really good support system, and, like, my classmates were extremely kind, and, even, like, throughout the holidays when I couldn't come back home. But yeah, the program was, like, super, super hard. To be honest with you, I thought it was harder than biology. Say that, but it was definitely harder. It's terrible to say that I undermined the program when I first started. I remember telling a friend, "Well, it's just hygiene. Like, it's going to be super easy. I mean, I have a bachelor's in biology." And I was kicking myself when I was in the program because even though I had a baseline in dentistry, because I understood the terminology somewhat because of my dad and because I had worked in the space already a little bit and I had a good background in biology, I still struggled in hygiene. I mean, I did great, don't get me wrong. I had a great GPA. I was at the very top of my class, and obviously, I think it's because of my background. I was very blessed and lucky, but I can't imagine all of the high school students that were coming in straight from high school or people that didn't have any sort of experience that came into the program. It was a very, very hard program.
Yeah, and that's what I think is so interesting about dental hygiene and the program itself is like really it doesn't matter who you talk to. It is a shared experience of being super difficult. We have very similar stories. I had a background in a biology degree as well, and when I stepped in, I mean, it's just a different ball game, you know? It's like you're juggling things that you never thought you would juggle. A part of me almost wonders if the students coming in right out of high school, maybe they're used to that regimented school schedule and maybe sports and like doing a bunch of different things that you kind of lose throughout the college experience, but
And
it's hard.
you know what? It's not just didactic classes. Like you also have to come into like so you're not only mentally tired because you've been, memorizing all of these things and you've been reading and staying up late, but now you also have to see patients and like your fingers have to work too. So it's just like all of it is just draining.
Yes, mentally and physically exhausting.
Physically.
Yeah, absolutely. Well, I'm sorry that you felt lonely. It was hard mentally, but obviously the pain was worth the reward of getting through,
Oh, it was
right?
worth it. I'm
Yeah.
so glad I did it. It was an amazing experience. I Whether or not like, you're in hygiene school, you're going to hygiene school, whether, it's far away, definitely go back to like visit your families if you can. But if you can't, know that it's only temporary, like you will eventually come back. You just
Yes.
have to give it your all and stay in the program, stick to it, and before you know it, I'll be done.
Yeah, absolutely. Very true. After you were done, I mean, you've done so many incredible things. Now you own your own business. What was that transition like? Or tell us the progression of like you graduated into owning your own business. Lay the
Sure,
framework for us.
sure. So I graduated. I started in a very small geriatric practice, and I just worked in a few different practices. I temped for a while, and then I kind of stepped into a DSO, and I worked in DSOs most of my career. I particularly liked it. I know it's not for everyone, and I just like the structure. I like the hierarchy. I like the how you're able to manage your own schedule and your patients. So it just worked for me. But in that transaction, I worked for Aspen Dental, and in Aspen Dental, we had a AI software. We were working with Denti AI. So with Denti AI, I was providing a lot of feedback and working with them. So I developed a big interest in AI and AI tools. I interviewed with a few companies, and I realized, this is definitely something I want to do. And if I want to be taken seriously, I feel as if I need to go back to school and get a master's degree because I felt as if I wasn't really getting anywhere. And I think it was a humbling experience because, once you're a vetted hygienist and you've been working in the industry, I feel as if you can kind of get any job you want and you kind of forget that, you are experienced and you don't have to struggle with, having the experience in your resume, right? But it was a humbling experience in the sense that I had no's in my interviews and I had to kind of stop myself and think, what can I do and what can I change so that I can be taken seriously? So I ended up going back to school while I was working a full-time job and training. I was training hygienists in the company. And, in the transition, I mean, I felt like I was drowning because I was juggling not only, school full-time online, but full-time work, training, as well as finally, like, being a mom, after, struggling with IVF, and infertility for so many years. So I kinda wanted to do it all, and it was just hard to maneuver, but I did it, and once I finished my master's, I continued interviewing in a whole bunch of jobs, and I finally got an opportunity in one of the companies, and I worked for them. And little by little, over time, I ended up getting known and ventured out to other companies. And I'm an independent consultant. I work with a lot of AI startup companies. I serve in the product development area, in the clinical, and I serve as an advisor as well. So that's kind of like my different roles. But within that, I realized there's so many companies that are coming at me that wanna work with me, and there's no way for me to work with all of them, so I end up coming up with the idea of, what if there's hygienists that actually want to do what I'm doing and are having a hard time like I did, trying to get into the industry. So I developed a program, which is like a one-on-one coaching, where it's either a 4 or 6 week program. And in that program, I do coaching, but in the end of it, I actually introduce them into the AI world and introduce them into like to the companies. So a lot of them end up working with AI companies. So they kind of skip over going through, the hassle of getting a master's degree, because to be honest with you, the master's degree that I received, I didn't really teach me anything that I already didn't know as a hygienist, because it wasn't specifically in dental AI. Maybe one day there'll be that type of degree, but I took a very generalized like master's degree and I kind of adapted it to what I was already doing. But it just kind of helped me to be able to be taken seriously. So I am now that help to other hygienists that want to come into the industry that need that help, and be that voice so that I can help them through like their interview process, through their resumes. So that's what I do. And that's how I ended up where I am now.
So incredible, Maria. I mean, I love meeting hygienists who A, think outside the box, B, follow their passion. Like you recognize I'm really interested in AI and dentistry. How do I push myself to get out there and try these new things and go for these new roles and pivoting, adapting along the way, all while juggling motherhood and a full-time job? I mean, that's just amazing to itself. So if you have not, congratulated yourself recently, I think you should be doing that. And beyond that, recognizing that you can't do it alone and you can lift others into those roles by what you've already experienced, right? And that's exactly what I was going to ask you. I'd say, so you're training people, to step into these AI roles, training hygienists specifically, and you're telling them you don't necessarily need to take my route to get the masters. I can help get you what you need and get you into the space. And half of the battle is networking and getting into the space. And but I also think being a dental hygienist comes with so many incredible skills that, like you said, they're already there within you, but you just maybe have to tailor them a little bit for the next transition. And I love that you're helping people do that. So thank you for giving back to others and helping them, yeah, achieve life as a hygienist that may look different. Our students, they don't always know what's possible. I did not know this was possible until I met you. So yeah, super amazing. I love it. So I have to ask the question, do you think that the day will come that dental hygienists could be replaced by AI?
I think you still need that human touch, like regardless of what like robots can do and where we're heading. I work with a lot of startup companies, and there's definitely companies that already have robots in place that can not only place into implants, but they can make crowns, right? But you still need that human touch to be able to, help patients. It's not all about just cleaning teeth, right? It's about education. They trust you, you recommend to them different products, and it's not just that. It's like the emotional factor that you get to know them, you get to know their families. And I think that that's the part of dental hygiene that I particularly miss, because I don't really get to work with patients like that anymore.
Yeah.
I get to make an impact in a different way, but I don't work with patients anymore. But that's where hygienists are special, in that it's not just like your hands and what they can do when that you can clean teeth. You're not just cleaning teeth. You are a whole person, and you have a whole history and background behind you, and you get to establish like a really nice relationship with that patient and really get to know them over time. So no, I don't think AI can replace the empathy and the emotion behind that. What really centers and values brings to like a hygienist. So no, I don't think so. I think it's there to help.
Yeah.
I think it's there to guide us and help us in any way that we can help patients as well, with patient images and education and products, so that we're able to explain what's happening in their mouth a lot better. But yeah, I mean, I think it's phenomenal. It's just the way you use it,
Yeah.
right? Like it's just as long as you use it and you have that in mind, and you have the patient in mind, I think it's all great.
Yeah. And something that you said, you mentioned, I love taking care of my patients. I like that patient interaction. So you think about there's going to be 1,000 other or millions of other, however many hygienists like you who while we may not work clinically, we still have that passion. There's still a bunch of clinicians who are actively working clinically every single day, and they still have that passion. And I think if we have the passion for our patients, like we enjoy seeing them, taking care of them, treating them, you're also going to have the same. The patients are going to enjoy coming to see you, wanting to be with you. And we keep hearing like people are craving authentic interactions with other people as AI is rising. But as you said, it's such a great tool. So, really briefly, could you just share what are some things that AI is doing for dental hygienists right now?
Sure. So there's, as you know, like a lot of companies that have they're in the imaging AI, which they colorize the calculus, bone levels. It actually measures from the crust of the bone all the way to the CEJ so that you don't have to kind of point at these like gray images where like the patient doesn't really know what you're talking about. It's fully colorized and it's right there for them to see. There's also automated perio charting for hygienists that you don't need to pull in another dental assistant to help you, or maybe you reaching into the keypad because like there's nothing else you can do, and you're going back and forth, and it's just not like it's not very efficient, hygienic, or any of that. So voice AI takes away all of that, and then there's tools like notes, right? Instead of spending time typing your notes, there's voice AI where you can actually voice all of your notes inside your templates and it just generates for you. So, I mean, there's a lot of things out there that can help us be more efficient, and we can spend more time with our patients instead of, I'm sure there's a lot of hygienists out there that can agree that, at the end of the day, like the worst thing is, your room is dirty, your patients are gone, you're drained, and now you have to clean everything and sit down and write all of your notes that you haven't been able to write. Let's say you're behind two, three, four notes. Now you have to think back of all those notes. I mean, now it does it automatically and you can just voice it in.
Yeah, which when we think about a lot of issues that hygienists concerned with or are concerned with when it comes to burnout and the stress related to the job is not having enough time. You're just like, I always say hygienists work in seconds, not even minutes. If you if you lose a few seconds somewhere, it's like hard to even come back. You may be, running over for your next appointment. So I love the advances. I think they're great tools. And I really am excited to see how they continue to further our profession and make our lives easier, but also maybe make diagnosing more common ground, fewer errors, getting things a little bit on track, I think can be really helpful using tools like that. Well, Maria, I'm so excited for you and your program. Will you tell our students, because this will probably be releasing near the summer, so we'll have some graduates coming out, maybe thinking about a career in AI one day. So where can students find you if they're interested?
So I have my website, dental Maria Maria dentalai.com. You can find me there. You can find me on LinkedIn. Something I would highly, highly recommend to all students, get a LinkedIn account, start networking right away. Because it's sometimes, like you said, it's not where you apply or your experience, it's who you know and who you've networked with. So that's very important. So start establishing your online presence, because you never know when you're going to need it and when you need to tap into it, and you never know what else you might do, right? Like you might not want to do what I'm doing, right? You might want to teach, or you might want to be a product rep, or there's just so many jobs out there, but you want to be able to not only add to your resume and your CV, but keep up with all of that. LinkedIn is a great space to do that and keep connected with other professionals like yourself.
Absolutely. Couldn't agree more. Wonderful advice. So excited for all you're doing and excited to watch how this continues to grow. And hopefully, we'll get some listeners one day enrolled in your program. But thank you so much for your time, Maria. We really appreciate it.
Thank you so much. I appreciate it.